I'm Rashmi Halkar Singh. I'm the Deputy Editor of Headache, and it's my pleasure today to be joined by three colleagues, members of the Practice Management Committee of the American Headache Society, who are authors of a recent publication entitled Towards a Standardized Process of Onboarding Advanced Practice Providers into Headache Medicine Practices in the United States. Expert consensus from the American Headache Society Practice Management Committee. So welcome to Calli Cook, Marius Birlea, and Brad Klein. I'm so happy to speak with you all about this recent publication.
Thank you for talking with us.
Yeah, thank you so much, Rashmi.
So first of all, can you tell me about what prompted you all to do this really important project? What was the impetus?
Well, thank you, Rashmi. I think we all understand that, advanced practice provider training is so critical to headache care in this country. And we want to make sure that there's certainly a understanding of how to care for these patients most effectively. And we understand that there's also a lot of variability across the country on how that training takes place. So by trying to create a standardization across the country, we can try to ensure that that quality care is the same across the country. And that also not only helps our patients, but also helps advanced practice providers make sure that they understand, they feel comfortable, they feel confident in the care that they're providing to the patients. And also for the neurologists who might be training advanced practice providers or other APPs training other APPs, that we understand how to make that happen so that way APPs can really do the best care provide the best care that they can for all patients, and everyone can feel more comfortable that APPs can also provide excellent care to those patients.
I love that. So truly, it really does help the clinician, the advanced practice provider, and also ultimately the patient is who benefits from this work.
Absolutely.
So tell me, as you look at these recommendations, what are they? Can you give us a high-level overview of what you all came together with?
Um, if I can go first, the recommendations are actually some guiding tools. I want to emphasize these are not evidence-based guideline recommendations, but we think these are best practice tools for headache medicine practices across the country to use, as Dr. Klein was mentioning, to standardize the onboarding. And we talk here about the clinical onboarding. While in the paper we touch a little bit about the administrative aspects of the onboarding, we thought it was important for us to emphasize some of the needs that we think are there in terms of training the APPs in headache medicine. And through some process that is described in the paper, and we can elaborate on if time, we came up to a few important questions. For example, what is the duration of the onboarding? What does it mean to supervise an onboarding APP? What is required for the formal education in that? What's the standard that's recommended or is expected for procedures? And then what's the curriculum? So these are the few important questions that we try to answer.
So you shared that these are not evidence-based guidelines. So in that sense, how was the decision made to come up with these specific recommendations?
So I can talk a little bit about that. As a group, and thanks for that question, we really wanted to think about every perspective of the clinical team. And we represented the APPs and our physician colleagues well in this. And we looked at what do we need for a smooth transition of practice, and what does a transition of practice mean for an APP in headache medicine? And when you think about the way APPs are trained, which is in a generalist model, and how specific headache medicine is, we knew that we needed not just administrative functionality for onboarding, but also clinical, and as Marius mentioned, procedural, all of these ongoing education interventions for the APP. So as a group, we looked at what was available, and then we also created a survey and we sent it to both our physician and APP members within American Headache Society to better understand what they thought was needed. So this is expert consensus from the Practice Management Committee, as well as a survey of our members to better understand the need of this particular community.
I love the diverse perspectives that were taken into account, and it really seems like everyone who is really at the front lines, their experiences were brought into this as well. So that I think that's really important to highlight. what do you see as the most what might be challenging to implement as you all think about the work that went into this and think about the clinicians who might be needing to use these recommendations?
We what motivated me to get into this project, except saying yes to my boss here, was that I was dissatisfied with the onboarding of APPs in my own practice. So I really thought that there is a lot of work in doing this. I think the main challenge is to uh, get into implementing into various practices, because there are academic practices, private practices, larger practices, smaller practices, pediatric, adult. So with the recommendation, we wanted to offer some flexibility for individual practices to adjust the recommendation according to their own uh, situation. So I think that that would be the main challenge, plus the distribution of recommendations. Um, One of the questions we had from the reviewers was who is going to pay for this.
Mm.
I think there is some the challenges with that, and the lead clinicians, what we outlined in the paper, that oversees the onboarding process, may need to be compensated for the time and for potential loss of productivity. But I think all these things are doable, and the systematic approach is preferable than leaving it to the individual practices. Dr. Klein?
Yeah, there is a plethora of data though that supports if you provide the right training to advanced practice provider and headache care, that return on investment is many-fold more, not just from a financial standpoint, but certainly from a quality of care standpoint, the confidence that you could have in that advanced practice provider to provide appropriate patient care, the confidence that you can know that they can take care of those patients without much involvement of you necessarily. So, and improving access into your community for headache care. So there are many great reasons why providing the right type of training has such a significant value in this conversation. And I don't think that anyone should be shirking on ensuring that the people that are going to be entrusted to provide patient care should be less than that level. So I think this does raise the bar a little bit, but I think ultimately I think we'd all agree in the medical community that we want to strive for excellence when we're providing care for our patient population. So while there are going to be some challenges to get to that level, I think there's some value in always trying to aspire to that level as we go forward.
You all make such excellent points.
I'd like to add one
Yes,
thing, if
yeah.
possible. I also think that this paper touches on the cultural needs of the clinic and the community, and how relationships are really important. Because when we create an onboarding plan like we've outlined, you're investing in that member of your team. And when we think about retention and what that investment looks like long term, that's really important, because not only are we looking at quality, which is essential and an essential component of care, but then we're also looking at what does the long-term relationship with this person looks like, and are we building the culture that really emphasizes what we want when we dive into practicing team-based care.
Oh yeah, that's a very good point as well. You've raised such important points, and another thing, what do you all know about the American Headache Society providing additional support and resources to support this initiative and this whole, the clinician, the physician, and the APP, this model? Are there things that AHS is doing as well?
So I think it suggested to us that we can make things like an infographic that utilize the social media to promote our work and recommendations. But I personally haven't done much of that with anything else.
I think that the AHS has created a platform for APPs, which is important. Seeing them as a valued member of the society is key. And as we see the roles of APPs become more common in specialty practice, the emphasis on including APPs within societies or academies of specialty practice is really important. Because again, when we think about relationships, we think about teams, wouldn't you want to go to a conference with your whole team? I mean, isn't that the point? So I think that is something that AHS has done well is having the APP group and having a place for APPs within the society.
And I think it's also really important just to kind of come in what Calli said, that by having APPs part of the organization, by having neurologists and APPs and other physicians and other clinicians and other stakeholders involved in the American Headache Society working with APPs, that just expands the dialogue, the conversation to help us figure out, how do we do this best? How do we take care of our patients best? And so I think this paper will help pursue that, whereby people will dialogue about it more, perhaps discuss it at the conferences, maybe even present a presentation on it, where people will become more exposed. And we can have that dialogue, of course, as to does it need to be fine-tuned as we go? Is this where we're trying to aspire to the best? So there's lots of different opportunities. I think the American Headache Society can continue to offer work like this.
One more word, Rashmi, if I may.
Yes.
Uh, I do perceive, and Calli, you can tell me if I'm wrong, that there is a gap between how APPs perceive themselves in relationship to the AMD physicians. And I think this paper is contributing a little bit to closing the gap. And one word about the curriculum is it's pretty, I think, extensive and complex. And another concern that was expressed is that to cover all the curriculum is going to take a year of full fellowship. Yes, raises the bar a little bit, but I think it's important to try to contribute to filling that gap. And our goal was not to have it covered during the duration of onboarding, but to serve as a guide for the new APP for the preparation, potentially set some expectations. And we don't require mastering of all these elements in the curriculum by the end of the onboarding, but some that were specifically mentioned, like ICHD main criteria for primary headache disorders that are important, red flags, indication, contraindication, side effects of main medications and procedures. So I think it's reasonable and doable.
Yeah, I support what you're saying. Any additional thoughts or things that you want to share with the audience?
I would say if I may speak for all of us, I think we're all very excited for people to read the article, to see how they can implement that in their practices and really continue raising the bar.
Well, yes.
I also hope that the audience is going to be beyond AHS. I think this can be a model for other specialties on the approach that we suggest for onboarding of APPs into headache medicine for these examples, but not only.
Yeah, and to that point, this is an invitation to APPs to consider headache medicine, to consider neurology, that there are groups of people that are interested in taking this person who's trained in a generalist model to something specialized, that they have a specific passion for working with people who have headache disorders or neurologic concerns. So I think that's very exciting as an APP.
I want to thank you all for your work. This is such an important contribution. And so thank you so much for providing this framework for all of us.
Thank you very much.